Barry Hall I'm a principal with Buck Consultants. I'm speaking at a couple of the different conferences on different aspects of wellness, workplace wellness programs, how they relate to healthcare reform, and how they relate to what are some of the best practices that employers are doing with respect to workplace wellness. I'd like to share information. I'm a consultant with Buck Consultants and work with a number of different employers, so I think there's a lot of opportunity to share information about what's working and what isn't working in different organizations. And also I do a survey, a global survey of employers that I run for Buck Consultants each year about practices in wellness programs around the world, and I'll be sharing some of the information from that. I think some of the highlights of the conference are it's a good forum for employers to get together and share information about what they're doing, what's working, what isn't working. I think there's a lot that we can learn from each other, because most of these areas, whether it's healthcare reform or wellness or medical tourism, they're all new ground for most employers, and it's an opportunity to share experiences and find out what's working. Well, my organization, we like to keep on top of what's happening. And so it's a great forum for us, not only to share what we've learned through some of our research and working with some of the employers that we work with, but also to learn from other people. Well, I think the most immediate role of, actually the answer to that varies depending on where you are. For U.S. employers, and this is what we learned from our research, the most immediate goal of wellness programs is to reduce the amount of money that they spend on health care for their employees, and that's a big issue for employers in the U.S. And we look at it globally, and in other parts of the world that's not important at all because they don't pay for the health care. And in other parts of the world they're interested in keeping employees at work, helping them come to work, not be absent, and having them be as productive as possible while they're at work. And those are issues for U.S. employers as well, but they're just kind of second and third behind healthcare costs, which are really the main driver. It's interesting because wellness is something that employers all around the world care about, but they care about it for different reasons. Because as you said, in France, the employers aren't paying for the health care, so their objectives are different, yet it's still important to them. And why is that? It's because we're learning that, and I think we've always known that healthier employees are better performers, and it makes your company or whatever organization you are, it makes it better to have healthy people working there. Part of the challenge with workplace wellness programs is that the results don't happen immediately. So if you can help employees have better nutrition, exercise more, quit smoking, some of those results aren't immediate. So it is kind of a long-term proposal to get it to work, and those employers that are really kind of in it for the long term are the ones that are going to succeed the most. The long-term benefits are having a more productive, more engaged workforce, a place that people want to be, people want to work, so you can keep the people that are most important to you and keep you working for a long time. It's pretty important to have a strategy, and that sounds maybe intuitive, but a lot of employers today don't necessarily have a wellness strategy. They may be doing some things and putting some programs in place, and to be fair, that's what most wellness programs were in the past. You put in a gym membership program, or you have a health fair at work. Today, employers are realizing they need to have a strategy. They need to sit down and think and document, what are we doing, why are we doing it, how are we going to know if and when it's working, and define that. And that's one thing that we look at in our survey as well, to see what are the percentage of employers that have a strategy, and we've been seeing that increasing year over year. So it's something that's happening, definitely. Well, I think a lot of what wellness is about, and really all aspects of health that employers are focusing on, is awareness, is having people pay more attention to their health and pay more attention to their health care, and what are the best things that they could be doing, how can they get the best quality, how can they get the best outcomes, how can they get the best pricing. And we know, I think it's no secret that the U.S. is not necessarily the best at healthcare, that there are other centers of excellence, places in the world that can do things better and cheaper. And I think it's sort of a raising the awareness of that, and perhaps in the public's mind that U.S. is not always, at least for U.S. employers, U.S. is not always the best source for some things, and appreciating that there's some value in going elsewhere to get some things. I think all these areas are merging, and wellness. I think that areas like medical tourism and wellness are merging to some extent in terms of how employers think about them, in terms of how employees think, because at the end of the day, it's about your health and how you take care of yourself and how you get health care, and being smarter and more aware of what's happening, I think, is the end result for all of these areas. It's been very encouraging from what I've seen so far. It's we're still in the first day here, but I've seen a lot of activity, a lot of energy, a lot of different vendors, employers, speakers. Seems like it's set up for a lot of good interaction.